So autism, the autism spectrum disorders, are a spectrum that goes from relatively mild symptomatology to really severe symptoms that impact every aspect of both the child and family's daily existence. The reason why it's so prominent in pediatric practice is the prevalence. The new CDC statistics as of March 2014 are 1 in 68. 1 in 68 children in the United States have been diagnosed with an autism spectrum disorder. It's critically important that pediatricians are aware of the early symptoms of autism, because they're the ones that families go to when they have concerns about their children early in childhood, and they're the ones that can identify the early symptoms that get children to effective services. The way that we diagnose autism and other behaviorally defined disorders is by behaviorally defined criteria. From 1994 until 2013, we were operating under a manual called DSM-4, the Diagnostic and Statistical Manual 4. Under DSM-4, the diagnostic category of what was autism was broadened, and the term pervasive developmental disorders was included to include people who had high functioning, people who had typical cognitive abilities but a lot of restricted interests, and people who were low functioning, people who had intellectual disability but also had repetitive and restricted behaviors and social differences. So the idea of a spectrum was introduced in 1994. What happened in 2013 that we implemented in 2014 was the new criteria. What the DSM-5 reflects is that interim period of knowledge where we've learned that although there is a spectrum, we don't have a set of artificial distinctions within that spectrum. So instead of having multiple subcategories within a pervasive developmental disorder, we're calling it autism spectrum disorder. Why is it in the news? It's in the news because it's common, because it impacts multiple aspects of family and child existence, and because parents are quite verbal about what they need. That there's been a very strong advocacy and self-advocacy movement to address the social, medical, and societal supports that are necessary for people with autism to reach their potential. We have no evidence at this time that vaccines are a cause of autism. However, we do know that autism risk is predisposed by multiple genetic factors, and these genetic factors are turned on and off by environmental events. We don't know what those environmental events are. They're not vaccines to our knowledge, but that certainly this is an area that requires additional research on both the basic and epidemiologic level. So there's a raging debate about intervention versus cure. There's a subgroup of individuals with autism who truly have optimal outcome, who get early intense behavioral services, and who really are almost indistinguishable from their siblings and typical peers. Our focus with autism isn't cure. Our focus with, I suppose it should be cure. Our focus with autism is really working with each individual behavior, with each individual ability to maximize functionality. And that's what we want for all of our children, not just our children with autism. Treatment involves evidence-based intervention that we know makes a difference for early childhood development. Learning skills, learning adaptive skills, learning language, learning communication if you don't have oral language, managing the anxiety and stress that result in behavior, managing the sensory symptoms. And I think that what we will find, and we will continue to find, is that people with autism will optimize their skills in all of these areas. And what's really critical is that we as pediatricians turn over our families with autism, the children as adults, to society as healthy and productive members of society.